Good morning. My name is Fran Cunningham, and I'm the Director for the Center for Medication Safety and Associate Chief Consultant, Pharmacy Benefits Management, Department of Veteran Affairs, National Office. I would like to thank Dean Schumacher, the University of Illinois faculty for inviting me, and also the graduating class of 2021, family, and friends for allowing me to share in your very special day. When Dean Schumacher contacted me and asked me would I like to speak at graduation, I said, "Really? You want me to speak seriously?" In all honesty, I was very excited. I had said an unequivocal, resounding, absolutely. Two of my favorite things. How can I say no? UIC and talking to students. But then something happened. I had to think about what I would talk about. What could I say that was encouraging to graduating students in times like these, challenging times? Although things are getting much better, they're still very challenging. And so one of the things happened is that I had a chance to view a video of the college a few months back. And the title, specifically, Rising to the Challenge, UIC College of Pharmacy. And just like that, everything was crystal clear, and I knew what I wanted to talk about. Because class of 2021, you are the embodiment of this college, and you have overcome so very much over this past year. You, class of 2021, have risen to the challenge. And what a challenge it has been. During your third year, you survived movement from a traditional classroom setting, and for part of your fourth year, depending on where your rotation was, to 100% virtual learning. And you were used to this. You had a Rockford campus. And some of you are used to this out of what you like to do. So let's stop and reflect on that. What do I mean? I mean that for some of you, this was a good way not to be noticed that you weren't coming to class, that you didn't come to class anyway. And so virtual learning was something that you were very proficient at. So exceptional that it became what we needed to do. You were able to help some of your classmates and even a professor or two. But in reality, there were lots of other challenging things you had to overcome. You had to adapt your clinical rotations to being a healthcare student in the middle of a pandemic. For those of you working on your master's and or your PhD, some of your research labs were shut down and or your research projects were delayed or halted, requiring you to totally revamp your timeline and to reset. For all of you, all of this while trying to live your non-student day-to-day life, a life that no matter what was happening at the university, there was still so much that you were aware of or that you were being affected by in the world surrounding you. Consisting of the pandemic, which was so totally out of control, with unimaginable losses of life. Loss of life, people that meant something to someone out there and somebody and should never ever be forgotten. Civil unrest across the United States. And a Band-Aid gently stripped away, and just under the surface, there was healthcare systems across the U.S., the systems that you were about to walk into that were on the brink and needed a rescue. poverty was unmasked and injustices long known by many or experienced by many of us brought to the forefront of this nation. But in the midst of all of this, there are some amazing things happening and occurring around this country. And more importantly, there are some amazing things happening to you as a pharmacy student. So what were those things? Well, I don't need to tell you. You were living it. You were reading about it. Just think about this. As a fourth-year pharmacy student, you experience things it takes 10 to 20 years to experience in 1 year. You were given the opportunity to do things that were unimaginable to help patients. That's important. In addition, there were things going on around you that were phenomenal. In 1 year, vaccines were developed to prevent COVID-19 that were up to 95% effective. 95% effective. Unimaginable. In addition, there were several clinical trials that were conducted across the world in rapid speed, allowing for results to be analyzed in record time and information to be shared across the world to help with COVID-19 treatments. Also, information was published rapidly in medical journals, sharing results and real-world practice, allowing for practical applications. Again, unimaginable in a healthcare setting. But being a pharmacy student at UIC, you are aware of vaccine development. You are aware of research occurring at rapid speed. Being a student at UIC, you know what this is like. You have chemotherapeutic agents being developed to treat breast cancer, novel treatments for women's health being developed by your very own professors. They teach you. That's the norm for you. As you were hearing throughout the last year about healthcare disparities and healthcare inequity that were buzzwords to other people, healthcare disparity and health inequity was taught to you throughout your entire training period. Preventing healthcare disparity and healthcare inequities, it's what you do. It's who you are as a pharmacist and what you do in your day-to-day practice. It's not a buzzword. You, class of 2021, were part of all of this year, from treating patients in hospitals with various comorbidities to assisting in some form of COVID-19 vaccines or testing. You were part of it all. My, just look at you now. Each of you has one or more of these experiences that help make you unapologetically yourself, an awesome pharmacist, an awesome researcher, and help you rise to meet the challenge and tell your story. You've grown so much through this past year, witnessed so much, and you'll continue to grow. So in this last 1 hour and 45 minutes that I'll be talking to you, I'd like to leave you some pearls. JKing. I know, I was where you were sitting last century. I'm going to try to wrap this up in the next 4 to 5 minutes. But I really would like to share with you some pearls for you to take away. Pearls that were given to me by my mentors or that I've gleaned along the way. First, no matter what direction you take or career path you choose, remember, the patient always comes first. Every patient is important and deserves not only your knowledge, but your compassion and your respect. I'm going to repeat that. Every patient deserves not only your knowledge, but your compassion and respect, regardless if you're in direct patient care, research, or policy. 2, treat all your colleagues and others you interact with respect, even when you know more than they do in a given area, especially when you know more than they do in certain areas. It is important for you to maintain those collegial relationships throughout your career. 3, remember you are always the drug expert on the team, research project, or board, or at the dining room table. Always be prepared. Know your stuff. What you say matters and contributes to healthcare. 4th, to remain happy in your career over the years, find new paths, projects, or areas to fall in love with over and over and over again. Keep it fresh. It's okay to think outside of the box. It's okay even during your career to take that road less traveled. You may end up where you're supposed to be at the time you're supposed to be there. Just look at me. I'm a prime example. So in closing, as you embark on your future, take time today to be thankful. Thankful to the institution that educated you. Thankful to the professors and staff that taught you. And most importantly, thankful for your family and friends that supported you. So UIC class in 2021, you've risen to the challenge. You finished this chapter of your story. You are all awesome pharmacists, clinicians, researchers. And to that, I'd like to say congratulations. And I've 3 words I'd like you to remember as you leave this door and go out into your career. Class of 2021, you've got this. Congratulations, and thank you for allowing me to share in your day.